Okay, so I'm gonna show you guys how to correct SI joint dysfunction problem. Okay, so of course, people with a SI joint problem, pain syndrome, of course, they shouldn't be crossing their leg. Try to not to cross your leg. I know it's difficult not to cross your leg because it's so habitual things. The reason behind people want to cross their leg because there's a tightness on their hip joint, and then their subconsciousness take over, and then they just constantly sending message, okay, you need to cross your leg. So in the case, what you gotta do is gentle hip, stretching exercise, and I'll always do both sides when you do hip stretching exercise. Okay, so Randy, what you're gonna do is putting your two fists, okay, close it as strong as you can. Okay, and then sometimes you're gonna hear the gentle popping sound. Where is that gentle popping sound coming from? It's coming from pubic bone, and it was misaligned, and then when it comes to normal, aligned again, even just gently pop back. Okay, after this, what you do is, okay, Randy, open it as strong as you can. Okay, you try to hold it. Okay, Randy is quite strong. Okay, and then that sometimes we'll put the SI joint in right place. Now, okay, Randy, you're gonna force it up, and then this leg, and then this leg same time, you're gonna press it down against the table. Okay, go, and then go. Okay, 1, 2, hold it. Okay, and then change. Okay, this one pressing it down, this one going up. Okay, go. Okay, good. All right, do one more time. Okay, go. All right. Okay, go. Okay, what it does is as if forcing is a femur bone down. Okay, and then it will gently align SI joint in right place as well. Okay, and then after this, what I usually do is try to check, which leg is shorter. Since I checked on Randy's X-ray, and it doesn't show that Randy has an anatomical shortness of his leg. So his shortness of leg, pelvic, is probably coming from the pelvic imbalance, SI joint imbalance. So as I examine his leg, I can see his right leg is being much shorter. So what I'm doing is I'm putting my two thumbs on his superior part of a malleolomedial. Okay, so gently, it's usually visually visible. You can even see which one is higher up. That means that part of SI joint is, that part of the leg is shorter. That means that his right SI joint having some problem, biomechanical issue there, such as, iliac, posterior superior part of iliac bone is being posteriorized. Okay, it will make his leg shorter on same side. Okay, so in this case, right leg being shorter, right SI joint dysfunction. Okay, posterior superior part of his right iliac bone is posteriorized. Okay, so I want to correct that part. How do I do that? Is there's a simple exercise. So what it does is okay, externally rotating on right leg, which is shorter. Okay, then make it straight, and his left leg. Okay, internally rotating. Okay, so 10 each side. What you can do is sometimes putting your hands and then causing maximum amount of stretching. Okay, and then two. Okay, down. Okay, so let's do it. If it came back. Okay, now it is balanced. Okay, and if it doesn't come back to normal, leg length, sometimes, like I said, it might be indicating anatomical leg shortness. Okay, sometimes there's too much of fixation going on, posteriorized, and then this stuck to the bone, and then sometimes you gotta help him mobilizing that bone. So I'm a chiropractor, I'm educating in this, so I'll show you guys what I do here. Okay, Randy, so you're gonna do lying on your side, facing this way. So what I'm doing is since I identified his right iliac bone being posteriorized, so what I'm gonna do is I'm putting my hands on posterior superior side of his iliac bone, okay, and then gently pushing it forward. Okay, there's a gentle cavitation there. Okay, and then the other side. Okay, this case, I wouldn't put pressure, I mean the impulse thrust on posterior superior part of his iliac bone because his left side doesn't have a problem, but usually probably it's anteriorized because the other side is posteriorized. So it's always like this. If it is posteriorized one side, and then usually the other side will be anteriorized. Okay, so I'm expecting left side is anteriorized. Okay, so what I'm gonna do is I wanna put it, release the pressure there. So what I'm putting my hands on his ischio bone, okay, side. Okay, what I'm doing is here. Okay, relax. Okay, good. All right. You can lie down facing up. It was already aligned by just doing simple exercises that I show you, like the 10 times the rotating of femur. But anyhow, just to check if it is aligned. Okay.